This is biotronics, physiotherapy, shockwave therapy, electromagnetic type. You can see the body looks like that. This is the horizontal model, and with the touch screen you can see. And this is the applicator, and this is quite heavy duty applicator. You can see, and this is electromagnetic. Uh, what electromagnetic shockwave means this is the probe. So the bullet travels from here to there, and when the bullet strikes, it generates shockwave. So the bullet travels because of electromagnetic field around the bullet. That is why the same is called electromagnetic shockwave. While the other is the pneumatic shockwave, air compression based, where the compression field let the bullet to travel from one end to another and strike and generate shockwave. So this is electromagnetic, where the bullet travels one end from to another because of electromagnetic field around the bullet. So now I will give the demo of the device, complete demo of the device. So I will switch it on, and Biotronics here International, we are the importer of the device, and this is the Dr. Shock Pro model. I have already switched on the same from the back side. I have already plugged in the applicator from the back side, and now I have to touch the screen. As soon as I touch the screen, I will get asked for the input code. The input code is by default 6 times 0, 0, 0, 0, 0, 0, 0. But in case you want to modify the same, you can modify the same also, and can provide the code to that person only who is authorized to use that device. So now I am putting the default one 0, 0, 0, 0, 0, 0. So as soon as I put the code, I enter to the interface. You can see these are the 10 protocols over here. So there are total 10 protocols, where 8 protocols for the physiotherapy, 1 for the ED erectile dysfunction, and 1 for the fat accumulation. So elbow, knee, shoulder, hip, pubic, hand, wrist, lumbar, and foot ankle. So this is the physiotherapy program, and this is for the ED erectile dysfunction, and this is for the fat accumulation slimming. So if someone wants for the physiotherapy purpose, the device will serve the same, and if someone wants for the ED purpose, for the clinical use, for the personal use, and for the hospital use, every machine Shockwave will come with, not only for the ED only, it will come with the physiotherapy and ED. ED is one of the program in the same, because there is only one organ involved in the same. Like in the physiotherapy, there are different joint and organs are involved in the same. But in the ED, there is one organ. So you will be getting the device, all the models and everything with the physiotherapy and ED. If you want to use for the ED, you can use the same for the ED. If you want to use for the physiotherapy, you can use for the physiotherapy only. If you want to use for the both of the conditions, you can use the same. Same device will serve that purpose. So now I will show you the demo of the device, and this is the applicator. You can see this is the applicator. This is the quality of the product. You can see there is a fan over here. I will show you once I will start the device, it will start on. And this is the head applicator. You can remove that cover and use the same, or you can put that cover to absorb the shock. So these are the different you can see attachments. You can see the side vary, the convex and concave thing vary. This is the convex. So there are total 7 different heads with the same. You can see, and also the cushion. These cushions will be provided. Now I will show you the demo by operating the same. You can see if I select the elbow program, I go to the elbow section, where you can see this is the indication. Now you can see there are recommendations, second and third. These two heads are in yellow color. As you can see, these two heads are in yellow color. So the yellow one is the recommended one to be used with the joint you have selected. But if other one is with the white color are not recommended. But if you want to use, you can use. But these are the recommendations. And apart from the same, there are other recommendations like number of shots 2200 per area, session 5 to 10, and interval 5 to 7 days. Also for the elbow, the default values are set over here. The energy selected here is 20 milliwatt, already defaulted set it, and energy is, frequency is 3 Hz, and number of shots 25 Hz. So these are the recommended ones. As soon as you select the program, these will be recommended one will be shown over here. You can use the same as it is, or you can vary the same also. And energy you can go up to from 5 millijoule to 200 millijoule. Recommended one was 20 millijoule, but you can go up to from 5 to 200. And frequency you can go 1 to 16. 1 to 16. But in the higher range of frequency, the energy will be automatically adjusted, because if you select the higher range of energy and higher energy is selected like 200, then in that case the joint may get injured. So if you select higher like 15 or 16, the energy maximum value will be automatically adjusted. Like if I go for the, I will show you the same also by operating the same. Now I am putting the frequency as 1 and energy as minimum 5 millijoule, and now I will show you the demo of the device. So I need to start the same. The device is ready. As soon as I start the same, you can hear the voice of the fan. The fan is to cool off the probe, because the bullet is striking to some surface, so that will generate, and traveling will generate heat. So to cool off that heat, the fan is there. And now as soon as I start that button, because I also have other models in the market don't have that hand switch, and our device is having the hand switch also, or the switch you can use in the touch screen also. Also, other device in the market is fiber or plastic based body, which is like can break over the circuit with what may get damage from here to there. But this is the metallic body. You can see this is the metallic body, not the plastic one or the fiber one. So Biotronic Shockwave is a metallic one, and with the foot hand control switch in the handle. Now as soon as I start the same, you can see this is the one frequency and energy 5 millijoule. So you can see shock waves are coming, and these are the pre-selected shots. I can select up to 5,000 shots. You can see. So once I start the same, I start the treatment, it will give me the shocks, and it will keep on counting the same. Once the same reach that value I have selected, the treatment will be over. Or if I want to stop the same in between, I need to press that. And if the patient feels discomfort, or the patient a doctor might want to have some rest or break, that switch can be selected, and the same that like I have already paused the same also. So if I want to resume the same, I put the same on the body and start with the same. So you can see it is getting counted off, and now I will show you by increasing the energy of the same. So 5 to 15, I am going up to 15. You can see 15. Now increase 25, 35, 45, 55. Wait. 55 is quite enough for my joint, so that is why I am not increasing the same above 55. I am decreasing from the 55 now and increasing the frequency. Decrease from 45. Now I can increase the frequency. 1, 2, you can see 3, 4, 5, 6, 7. Decrease the intensity. 8, 9, 10, up to 16. So you see the frequency I have varied from 1 to 16 Hz, and you can see the difference in the sound. Energy here is 25 millijoule. We can go up to 200 millijoule in the bigger area, bigger joint area, or bigger area with the more fat area like hip and all. So as you see, I have increased the frequency to 16. Now if I increase the energy here you can go up to 100 millijoule only, because you have reached the maximum frequency limit. And in the maximum frequency limit, the device will allow you to reach to the maximum value of 100. Because if you go up to 200, that may damage the joint, or that may give you the injury. So if I go below, like it is 20 Hz, then I can go up to 200 millijoule. As you can see, I have selected the frequency at 12, and I can go the energy up to 200 millijoule. But in the higher range, 15 or 16, I can go up to 100 only. So that is why the device is intelligent and show you the to avoid any kind of injury or because that energy will be too much, because you have that frequency, you have the 16 shots in one period of time, and it is very much high energy is supplied, then that can damage. So that is why in the higher frequency range the energy limit will be adjusted automatically by the device. So now you can see 206 shots I have taken out of 3350. So once the same will reach 3350, the treatment will be over. And always take care that you need to apply the, once you start the device, you have to make the contact with the patient body. Don't use the same in the air, because bullet is traveling from here to there and it is striking the surface and generating some energy, and that energy if going nowhere, it may damage the bullet also. So using the same in the air or somewhere without the body touch, it may damage the bullet. So always keep the same in contact with the body so that the energy will be absorbed and bullet life will be long lasting. Also the bullet get consumed because one thing which is traveling and striking, so that will get consumed and it will give a lot of shots, around 4 lakh to 5 lakh shots easily without get used up. After that you can go for purchase for the next bullet. You just need to open the same and using the key which is provided with the device and change the bullet and use the same. So likewise, this was the elbow, and if I go for the hip, you can see the applicator suggested head piece is different, 4 and 5, where in the same it was 2 and 3, and the frequency here suggested is 8 Hz, while the same in the was 2 Hz or 3 Hz. So according to the joint, all the recommendation and the default values are there. You can select, use the same, and you can vary the same according to the patient condition, patient body structure, and doctor manipulation and doctor requirement. So same can be varied also, frequency from 1 to 16 Hz, pre-selection shots up to 5000, and energy from 5 millijoule to 200 millijoule. So this was the demo of the device, and I think I have explained everything in the same. Apart from the same, in the ED I will also show you. In the ED section, you can see the recommendation is 1 and 2, these applicator, and pre-selection shot is 1500. You can go more than that, and the frequency here is 3 Hz and energy is 5, because 5 joule is energy quite enough for the ED purpose. So that is why if I increase the energy to the maximum value, I can go up to 30 millijoule only, because in the ED section 30 millijoule is very much energy, so you can't go be above the same, because that can cause a big injury, and that is why it is maximum limits are set up to 30 millijoule, and frequency you can go up to 10 Hz in the ED, while in the other programs you can go 1 to 16, but in the ED 1 to 10, and energy 5 millijoule to 30 millijoule. So that is why this intelligent device has already presetted everything, and all the things I have explained. If you still have any query, or you can put your number and your query in the comment section. Our sales team will visit you, and our sales team will contact you and share you the details. And you can purchase the same from our website. You can contact our sales team. You can mention your WhatsApp number or calling number. We will get back to you. Thank you for watching, and do subscribe our channel and share the video as much as possible to your other physiotherapy friends and colleagues. Thank you.